Good morning and welcome to another edition of CCH Checkup brought to you by Carroll Community Hospital. This morning we have joining us Dr. Rajani. He'll be talking about hernia awareness. Thank you for joining us this morning, Dr. Rajani.
Scott, thank you very much for having me. It's my pleasure to be here.
And let's start right off. What is a hernia?
A hernia basically is a protrusion of an organ outside its confines. For example, think of all your organs which are encased in an envelope. And if there's a hole or defect in the envelope, that organ can come out. And once it comes out, it's called a hernia. And any organ in the body can herniate.
And what causes a hernia?
Well, many of the hernias are congenital. You're born with a defect or you're born with a weak muscle or something, and then the hernia occurs. It can occur either when you're born or later on in life as these defects get larger and larger. The other cause, of course, is straining. When you're straining, either when you have a bowel movement or when you urinate, or when you cough a lot or strain, like lifting very heavy weights, it can put a strain on your muscles and cause a hernia to protrude.
And what are some of the symptoms that people have when they have a hernia?
The commonest symptom that people come to me with is a lump, a bulge which shouldn't be there. It can present as a pain in the area. Very, very rarely in the late stages, people can present with bowel obstructions, even gangrene of whatever is herniating.
And what can happen if you don't do anything with your hernia?
Well, think of it as, like we talked about the hole, it's letting the bowel or whatever fat or any other organ to come out through that hole. If that organ stays outside for a long period of time, it can get trapped in it.
Right.
Once it gets trapped, it can pinch the bowel off, for example, and cause bowel obstruction. And if it pinches it further and further, it can cut off the blood supply to that organ. Once that happens, it causes gangrene. And that is not a definitely good condition to have.
And what are the common type of hernias?
Well, as we talked about, hernias can occur in any part of the body with any organ. Hernias can be inside your body, for example, within the abdomen, like a hiatal hernia, or they can come out and protrude out from your abdomen or chest or wherever it be. And those, if they're in the upper part, they're called ventral hernias or epigastric hernias. If in the lower part, they can be called groin hernias. At times, if you've had surgery and there's a scar, the scar is traditionally very weak structure, and a hernia or the bowel can protrude through that weakness in the abdominal wall. And those are the commonest causes of hernias. There are many more which are internal.
Okay. And if somebody does have a hernia, what is the treatment that is common?
Now, for example, a hiatal hernia, we don't often treat the hernia itself. We treat the results of the hernia, which allows acidic gastric juices to reflux up into your food pipe and cause inflammation. So that can be treated with medication, and you do not need, most of the time, surgery. But with the other kinds of hernias, because of the risk of that obstruction and the gangrene that we talked about, people often need surgery. Now, the surgery can be done in many ways. It can be under general anesthetic, local anesthetic, spinal, and then we may or may not need a mesh depending upon the size of the hole and the type of hernia that a person has.
I think we learned plenty today on hernias, so Dr. Rajani, I want to thank you once again for joining us this morning. And as always, you can tune in next week for your next edition of CCH Checkup. And if you'd like more information on this or any other topic, you can check out cch-mi.org.